Hello ladies and gentlemen, and thank you for taking the time today to watch our health class video. The information we are about to present to you could not only help you make better and more informed decisions regarding the health for you and your loved ones, we actually believe it could add years to your life. What we will be discussing today is what health actually is, how our bodies really work, and how we can not just maintain health, but improve it into advanced age. So let's start with the question of what health actually is. Many of us believe that if we don't have obvious symptoms of disease, we must be healthy, right? But is that true? Well, let's look at some situations where this may not be the case. One of the most common symptom-free diseases is a dental cavity. Undetected, it has no symptoms. But when the toothache begins, the damage may be so severe it may need a root canal to fix. Other common examples are undetected heart disease, cancer, or early stages of diabetes. So relying only on symptoms to judge our state of health could in fact be fatal. Or let's look at the other side of the coin. Some of the symptoms we experience from time to time that we may want to suppress because we think we are sick may not in fact be so bad. Take fever, for example. In order for the body to kill off a particular virus or bacteria, it heats itself up a few degrees so that the organism dies. If we suppress it with drugs, we may actually prolong the disease process in the body. Other examples are coughing, sneezing, or vomiting. These are all healthy, natural ways of ridding the body from infection or toxins. Taking drugs may suppress the symptoms and let us be fooled into thinking we're healthier, but the opposite may actually be true. So true health then is what? Well, we believe it is when we are able to express our best potential physically, mentally, and spiritually. That means when our bodies and minds work the way that they are supposed to. That leads us to the next question. How do our bodies really work, and what controls that? All cells, all tissues, and all functions of the body are controlled by one master system, the nervous system. In other words, we live our lives through our senses. Even the immune system is controlled by the nervous system, and so are emotions. If we experience fear, our whole body will go into fight or flight mode and remain there until the fear has dissipated. So let's look at the nervous system. The nervous system comprises of the central nervous system, composed by the brain and spinal cord. These, of course, are housed by the skull and the spine, hard, bony elements to protect them in the best possible way. Then we have the peripheral nervous system, which is all the nerves exiting the spinal cord and branching out to supply everything in the body. The function of the body relies on clear messages from the brain through the spinal cord to all parts of the body and back again, just like a highly sophisticated computer system. As long as these messages can travel through the body without interference, our bodies can function and perform to its maximum capacity. But what if they don't? If these messages have some type of interference, the signals may be distorted or muted. Whatever is supplied by that particular nerve or group of nerves cannot function properly. A loss of health is a result. If nerve signals to a muscle is affected, the muscle may become weak, tight, or spasmodic. If nerve signals to the stomach are affected, indigestion, heartburn, or ulcers may occur. If the nerve signals to the lungs are affected, we may experience asthma. So what causes these interferences then? Well, stress. There are actually three types of stress that can affect the nervous system. Physical stresses, such as trauma, injuries, poor posture, or occupational stresses such as repetitive strain or computer work can result in the spinal bones jamming up or shifting out of alignment. When that happens, nerves that exit between each level of the spinal vertebrae may become chafed, pulled, or pinched. This is what chiropractors call a vertebral subluxation. In fact, the whole purpose of chiropractic is based on the detection and correction of the vertebral subluxation. A second type of stress is chemical stress, such as drugs, medication, environmental toxins, sugar and junk food, to name a few. The effects of the nervous system are the same as physical stresses, namely loss of function and health. The third type of stress is mental and emotional stress, such as fear, worry, anger, guilt, or grief. Negative physical consequences are the result. Long term, these will also cause a loss of health. Now, many of us are led to believe that when we are sick and receive medication, we get healthy again. But is that necessarily the case? Let's examine some statistics. First of all, Tylenol. Over-the-counter, completely harmless, right? Wrong. One of the leading causes of liver failure in North America today is Tylenol, not alcohol. And one of the leading causes of kidney failure in North America today is aspirin. It may prevent blood clotting, but instead can cause kidney failure. What about antibiotic overuse? About 90% of all upper respiratory infections are viral, which means antibiotics are useless. Yet about half of those patients still receive antibiotics for them. A nationwide survey indicated that children who receive 20 or more cycles of antibiotics are twice as likely to suffer developmental delays compared to those receiving 3 cycles or less. According to the American Medical Association, about 180,000 people die every year from iatrogenic injury from drugs and medication in the US. That equals 3 jumbo jet crashes every 2 days. According to American Medical News 1996, the annual toll of prescription drug-related problem cost $182 billion per year, kill as many as 200,000, and account for up to 28% of all hospital admissions. Drug benefit trend tells us that 32,000 hip fractures per year are attributed by giving the elderly medications that sedate them. That the elderly take on average 25 prescriptions per year, and that about 51% of all deaths in the elderly are caused by drug reactions. In 1994, Americans spent $73 billion on prescription drugs and another $76 billion to treat the adverse effects of these drugs. And of course, the major pharmaceutical companies have nothing but our best interest at stake, right? According to the Life Extension Organization 2005, the percent markup for the drug Claritin was about 30,000%. For Prozac, it was 225,000%, and the markup for Xanax was a whopping 570,000%. And how about lifestyle? In 1905, the US government did a study on how much sugar was consumed per person per year. The result of the study was that we consumed 5 pounds per person per year. The same study was performed in 1985, and the result was 150 pounds of sugar per person per year. And what would it be now? It is now estimated that over 2/3 of Americans are overweight or obese. Obesity is linked to diabetes, heart disease, arthritis, gallbladder disease, and depression. And look out for the diet products. Many of the aspartame or NutraSweet products actually contain a neurotoxin that may be linked to autoimmune diseases such as MS, rheumatoid arthritis, and others. It is estimated that more than 70% of these so-called lifestyle diseases could be avoided. What would that do to our overstrained medical system? So if drugs don't make us healthier, what does? When we are born healthy, we express full potential. We are able to fight diseases, recover quickly from injuries, our brains are clear, our senses work perfectly, and all our organs are healthy. Our joints and muscles are supple and strong. We are able to fully adapt to our environment. In fact, this state of health is called our optimum general adaptive potential, or optimal GAP for short. Over the years, if we overload the body or nervous system with more stress than we can adapt to, our gaps start to narrow. Our health starts to deteriorate. But we can improve our gaps doing certain things. What? By removing or reducing nervous system interference patterns. How? One way is the most likely reason you are here: correcting the vertebral subluxations of the spine. Now remember, vertebral subluxations not only interfere with spinal movement, but also with the spinal nerve at that level. This may cause neuromuscular interference such as muscle spasm or weakness. But it may also cause autonomic interference such as circulation dysfunction, or depending on which level is affected, headaches, asthma, indigestion, irritable bowel syndrome, and more. ADHD, ADD, ear infections, infantile colic or bedwetting may all be symptoms of nerve interference from vertebral subluxation. So how important is it then that our nervous system works as well as possible for as long as possible, for the rest of our lives? And how important is it for our kids' nervous system to function as well as possible from this day forward? And how about our pets? Yes, I did say pets. Actually, animals may suffer vertebral subluxation too. Injuries, illnesses, arthritis, hip dysplasias, not enough exercise, obesity, and other things may cause subluxation and nerve interference. I have seen many animals suffer back pain and incontinence, both which responded to chiropractic care. Other things that we can do to improve our GAP or GAP are, of course, eating healthy, whole foods, exercising, getting enough rest, and having a good vitamin regime. Other proven things are healthy relationships, laughter, a feeling of purpose, feeling part of a community, meditation, yoga, and owning pets. So now that we know about the GAP or GAP, how can we actually measure it? Well, we can do that through our Insight Subluxation Station or neuro-spinal scanner. This is a state-of-the-art space technology that can measure neuromuscular function, autonomic interference patterns of the spine, as well as a pulse wave profile, which in effect measures the GAP or GAP. This way, we can easily determine your state of health, design a customized care plan, and track your progress as you go. We asked the question earlier, how important is it to have as good functioning nervous system as possible for as long as possible, since that equates to the best chances for good health? Well, most of our patients think that it's pretty important. That's why many people, after having gone through their care programs, choose lifelong chiropractic wellness care for themselves and their families. Wouldn't we choose lifelong dental care, lifelong healthy eating or exercise? Don't we want lifelong regular checkups with our medical doctors? Of course! So why would we not choose lifelong spinal health care? Makes sense, doesn't it? And don't we want our kids to have the best possible chance of health? Of course! That's why getting our kids checked on a regular basis is so important. In fact, studies show that people who have ongoing chiropractic care get sick less often, take less medication, and report a better quality of life compared to people who don't. Of course, how long you choose chiropractic care ultimately is up to you. We are here to help you reach your health goals and help you make the best, most informed healthcare choices for you and your family. Thank you so much for joining us today in this video, and we hope your experience at this office with your chiropractic care is as good as we intend for it to be.